Hello friends! Today we are gonna talk about how to mobilize stiff finger movements when, as a result of injury or after surgery, we can't clutch a fist. What is important? It's important we are talking about very average and very general situation. Specifically, each case is individual and all of exercises presented here are best agreed with your treating physician. So, let's go. Where do we start? We start with warming up the hand because uh, in warm water our ligamentous apparatus, our muscles relax and the mobilization is much easier. We warm up the hand in warm water. In warm water at the temperature so that water feels warm, not hot. It's also useful to warm the hand in saline solution. 1 liter, 1 liter of water to 2 tablespoons of sea salt. Here such steering movement. In this way, in one direction we steer and we steer in another direction. We steer in one direction and in the other. With all movement in water not less than 2 or 3 minutes. The next thing to do, which also good to do in hot water, is called finger stretching. We take each finger by distal phalanx and pull it 20 times by a piece of tape or something like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We make it 20 times and hold it in the tension position in hot water, in warm water for 20 seconds. We stretch the thumb in the same way. 1, 2, 3, 4, 5, 6, and so on. When we stretch finger statically, they stretch thumb statically for 20 seconds. Why do we do this? One of the main reasons why finger not bent enough, why we cannot clutch it into fist after an injury is shortening the lateral ligaments of the joints. And it's precisely this tensioning of the joint that allows you to stretch these ligaments and improve the range of motion of fingers joint. After we warmed up our hand, we wipe each finger by towel from top to bottom. From top to bottom, each fingers. Why do we do this? One of the main reasons for stiffness of the fingers is edema. By such movements we have to reduce edema, especially in the fingers. Wiping should be done quite gently and easily. Gently and easily we wipe each finger. What we do next? We need table with sharp enough edge, on which we place towel. To improve finger mobility, for example, third finger, in the metacarpal phalangeal joint and in proximal interphalangeal joint, we place hand so that metacarpophalangeal head rests against edge of the table. We pull the finger along its axis and down. It's important to do everything in painless amplitude. The hand does not like to be mobilized through pain, especially in early stages after trauma. Therefore, we should do everything gently, without pain. We pull out and reach the point of limitation. 1, 2, 3, 4, 6, 7, 8, 9, 10. We do this 20 times and 20 seconds keep in static position. We pull and down. Then we move to next joint, the proximal interphalangeal joint of stiff finger. We shift the wrist so that proximal phalanx rests against the edge of the table and also pull along the axis and down. We do this gently without extensive effort and without pain. We also 20 times and 20 seconds in static. As you see, we do this with each stiff metacarpophalangeal and proximal interphalangeal joint. To mobilize the distal interphalangeal joint, which is very delicate joint, I do not recommend exercising over the edge of the table. Such mobilization can lead to pain and with hard manipulation to arthrosis onset. Therefore, we mobilize the joint as follows. We stretch something. So we stretch the and raise the finger. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We also make 20 times and 20 seconds on static. Now we put the finger so that proximal phalanx rest against the edge of the table and fully extend it and as far as possible and bend it in painless amplitude and hold it for 20 seconds. All manipulation we have to do without pain. What is important? When we passively mobilize the finger movements, it's utmost important to mobilize all the joint, metacarpophalangeal joint, proximal interphalangeal joint, and distal interphalangeal joint. So we do not bend the finger like this, but like this. We also repeat 20 times. The finger relax and we exercise in painless amplitude. So, and then we fix the finger in this position for 30 seconds and bend at the point of restriction, and we push it in simultaneously produce the transverse massage of the extensor tendon. Slowly, we push this finger into to the end point. Our goal is to make finger touch the distal palmar fold and then achieve the full extension. It takes for several weeks, or uh, uh, in complicated cases it takes for months, several months. We performed this manipulation on each finger, uh, which movement are limited. If we mobilize the thumb, we uh, it's important to achieve the base of fifth finger. 1, 2, 3, 4, when we make it 20 times, and also fix it in static position for 30 seconds. The next exercises are so-called block exercises. We are performed as follows. We fix uh, the finger by middle phalanx and bend the distal phalanx. 1, 2, 3, 4. We also 20 make it 20 times and 20 seconds on in static. It is important note that in this exercise, in addition to flexion phase, the extension phase is also very important. So we fully bend and fully extend the distal phalanx. We move to the next phalanx, the proximal phalanx. We fix the finger and bend the middle phalanx. 1, 2, 3, 4, 5, 6, 7. We also do 20 times, and flexion phase, no less important than extension phase. We finish with 20 seconds of static. After we have do this exercise on all finger which movements are limited, we clench the hand into fist for 20 times. 1, 2, 3, 4, 5. 20 times we make this movement. For the next exercise, we need some kind of soft ball. We squeeze with the soft ball in the hand and use the bottle to perform so-called myofascial flexor release. We make it, squeeze the ball and make it 20 times. 1, 2, 3, 4, 6, 7, 8, and turn the arm over and make 20 times extensor release, myofascial release. When we do this exercise, we stop in 10 centimeters from wrist joint, and we repeat this exercise 3 times. Another very useful set of exercises in order to restore both pinch grip and finger stress are clay or plastilin exercises. With a damaged hand, we pinch off the piece of plastilin and roll the ball. This can be done by thumb and forefinger or thumb and forefinger or thumb and middle finger. We roll several balls and like this, roll several balls by damaged hand, and with help of two hands from the ball and two toothpicks, we uh, we make some figures like maybe like this or or other figures, and we train the pinch grip and two hands work by this exercise. At the end of exercises, I highly recommend it to my patients bandaging the hand. For the bandaging, you can use an elastic bandage. What we are doing, we are making a couple of fixing rounds at the level of wrist and then tightly rub the fingers in a band state with one round obliquely, another round obliquely and little from above. We should keep your hand bandaged for 10 minutes without pain or numbness. At the end of this video, I want to repeat that each case is individual, and all the exercises presented here are best agreed with your treating physician. If you have a question, ask them in comments, and see you on the channel. Goodbye.